Stop reaching for the salt shaker and thinking that is the enemy. Stop blaming bread. Stop blaming bacon. Stop believing that the only way to lower your blood pressure after 60 is to swallow another pill every morning for the rest of your life. Because if you are over 60 and your numbers keep creeping up no matter what you cut out, the problem is not what you have been removing from your plate. The problem is what you have never been told to add to it. Here is what nobody tells you. After the age of 60, your blood vessels begin to lose something called endothelial flexibility. In plain words, the inner lining of your arteries gets stiffer, less stretchy, less alive. And when that lining stiffens, your heart has to push harder to move the same amount of blood. That is what high blood pressure really is. It is not just a number on a cuff. It is your heart working overtime every second of every day, trying to push thick blood through tired pipes. And the quiet danger is this. Most seniors do not feel it. There is no pain, no warning, until one morning there is a stroke, a fall, a hospital bed, a life that suddenly looks very different. But here is the good news and the reason to stay with me. There are 5 everyday foods you can buy this week at any grocery store that have been shown to soften those vessels, lower those numbers, and in some cases reduce blood pressure as effectively as a low-dose medication, without a prescription, without a side effect, without touching a single pill. And food number 1 on this list is the one most seniors already have in their kitchen and have been eating completely wrong their entire lives. Stay with me, because by the end of this, the change can start at your very next meal. A quick word about who is talking to you. The voice you are hearing is a 15-year cardiothoracic surgeon. 15 years of standing over open chests. 15 years of seeing what high blood pressure actually does to a human body from the inside. Arteries that should look like fresh garden hoses, and instead look like old leather. Hearts the size of a grapefruit when they should be the size of a fist. So the credentials are real. But here is the part that matters more. This is not just professional. This is personal. Because 2 years ago at a routine check, the cuff read 146/92, pre-hypertensive, heading the wrong way, fasting glucose of 124, pre-diabetic, heading the wrong way, and the doctor in the room, the one who had spent a career telling other people to fix their numbers, was suddenly the patient. So everything you are about to hear was tested first on the only body that counts. This one, and it worked. No pills, just food. Just the 5 foods you are about to learn. Now here is the reframe, the piece that changes everything. Because most seniors believe that high blood pressure is a salt problem. You have been told for 40 years to cut the salt, cut the salt, cut the salt. And so you did. You threw out the shaker. You bought the low-sodium bread. You read every label, and your numbers barely moved. And you thought, it must be me. I must be doing something wrong. You were not doing anything wrong. You were treating the wrong problem. After 60, blood pressure is not primarily a salt problem. It is a flexibility problem. It is a nitric oxide problem. It is a potassium problem. It is a problem of what your aging blood vessels are no longer producing on their own. Nitric oxide is the natural chemical your arteries release to relax themselves. Think of it as the signal that tells the pipe, open up, let the blood through, ease the pressure. When you are 30, your body makes plenty of it. When you are 70, production drops by as much as half. That is the hidden mechanism. That is why cutting salt alone never moved the needle. You were trying to lower the pressure in the pipes without ever giving the pipes the tools to relax. It is like turning the water down at the spigot when the real problem is a kinked hose 3 feet away. You cannot fix a flexibility problem with a sodium solution. And no one told you, because in a 10-minute appointment, there is no time to explain physiology. There is only time to write a prescription. Now let us be honest about what is at stake here, because this matters. High blood pressure is called the silent killer for a reason. It does not announce itself. There is no chest pain, no headache in most cases, no warning sign you can feel. But inside, every single beat of your heart against a stiff artery is doing microscopic damage, and the numbers are sobering. Roughly 7 out of every 10 Americans over the age of 65 have high blood pressure. Stroke is the 5th leading cause of death in this country, and the leading cause of long-term disability. Most strokes happen in people who knew their pressure was high and thought they had time. They did not have time. And here is the part nobody likes to say out loud. A stroke does not just end a life. Sometimes it ends a life inside a body that keeps going. The independence is gone. The driving is gone. The cooking, the gardening, the picking up the grandchildren, all of it gone. Replaced by a chair, a caregiver, and a son or daughter quietly rearranging their own life to take care of yours. So yes, the stakes are real. But take a breath, because here is the relief. The same body that got stiff can get more flexible again. The same arteries that lost nitric oxide can be coaxed into making more of it. And it does not take a miracle drug. It takes 5 foods, eaten the right way, at the right time, in the right amount. Starting this week. Here is the list. 5 foods, ranked from least powerful to most. Food number 5 is something almost every senior already buys, but eats too rarely. Food number 4 is the one most people assume is bad for them. Food number 3 is a vegetable hiding in plain sight at every grocery store. Food number 2 is the one almost no one over 60 eats enough of. And food number 1 is the single most powerful blood pressure food on the planet, and fewer than 5% of seniors are eating it correctly. So before going any further, a small favor. In the comments below, leave your age and your most recent blood pressure reading. Just 2 numbers, nothing more. It helps to see who is watching, and it helps you commit to the change. Now let us begin. Food number 5 is the humble beet. Yes, that purple red root vegetable your grandmother used to pickle. The one most seniors have not touched in 20 years. Here is what beets do inside the body. Beets are extraordinarily high in dietary nitrates. When you eat them, the bacteria in your mouth and gut convert those nitrates into nitric oxide. Remember nitric oxide? The signal that tells your arteries to relax? Beets are essentially a delivery truck for that signal. Think of your aging arteries as old, dry leather, stiff, cracked, resistant to bending. Nitric oxide is the saddle soap that softens that leather and lets it move again. Beets bring the saddle soap. One published trial in the journal Hypertension found that adults who drank about 250 milliliters of beet juice per day saw their systolic blood pressure drop by an average of around 8 points within a few weeks. 8 points. From a vegetable, with no prescription. There was a man named Walter, 68, a retired baseball coach from Knoxville. His pressure had been sitting at 150/90 for years. He was on 2 medications and still climbing. His daughter suggested he try roasted beets twice a week and a small glass of beet juice in the mornings. He laughed at her. He said beets tasted like dirt. She said, then drink the dirt. 6 weeks later, his pressure read 132/82. His doctor cut one of his medications in half. Walter cried in the parking lot. He said it was the first time in 15 years he felt like his body was on his side again. Here is exactly how to use beets. 2 medium beets, roasted, twice per week. Or a small glass of beet juice, about 120 to 150 milliliters, 3 to 4 mornings per week. Roast them whole at 400 degrees for about an hour. Peel the skin under cool water. Slice them into a salad with olive oil and a little vinegar. That is it. That is food number 5. It softens the leather. But the next food does something beets cannot do. Food number 4 is fatty fish. Salmon, sardines, mackerel, herring. And here is where most seniors get it wrong. You have been told for years that fat is the enemy, that fat clogs arteries, that fat raises pressure. So you have been eating dry chicken breast and lean turkey and wondering why nothing improves. The fat in fatty fish is not the fat you were warned about. It is omega-3 fat. And omega-3 fat does something almost no other food does. It lowers the inflammation inside the artery walls themselves. Imagine your arteries as a long hallway. Inflammation is the swelling that narrows that hallway. Omega-3 fat is the cool compress that reduces the swelling and widens the hallway back out. A meta-analysis published in the Journal of the American Heart Association looked at over 70 clinical trials and found that consistent omega-3 intake reduced systolic blood pressure by roughly 4 to 5 points in adults with hypertension. 4 to 5 points. Ooh. From a piece of fish. Dorothy was 71, a retired school teacher from Phoenix. Her pressure had been 148/88 for as long as she could remember. She told her cardiologist she hated fish. The cardiologist said, eat sardines on crackers twice a week while you watch the evening news. She thought it was ridiculous. She did it anyway. 8 weeks later, her reading was 131/79. She still hated fish, but she did not hate the number on the cuff. Here is exactly how to do this. 2 servings of fatty fish per week, about 3 to 4 ounces per serving. Salmon, baked or pan-seared with lemon. Sardines straight from the tin on a slice of whole grain bread. Mackerel grilled with garlic and olive oil. Twice a week is enough. Not every day, not every meal. Twice. That is food number 4. It cools the swelling. But the next food works on a completely different system. And it is one nearly every senior walks right past in the produce aisle. Food number 3 is leafy greens. Spinach, Swiss chard, arugula, kale, romaine. Here is what they do. Leafy greens are loaded with potassium and magnesium, 2 minerals your aging body desperately needs and almost never gets enough of. Potassium is the mineral that tells your kidneys, let go of the extra sodium. Magnesium is the mineral that tells your blood vessel walls, relax, you can let go now. Think of sodium and potassium as 2 children on a seesaw. For decades, the seesaw has been tipped too far towards sodium. You have been trying to fix it by removing sodium, which works a little. But the faster fix is to add weight to the other side. Add potassium. Add magnesium. Rebalance the seesaw. The American Journal of Clinical Nutrition published findings suggesting that adults who increased their daily potassium intake to around 3,500 milligrams saw an average systolic drop of around 7 points. 7 points. From a salad. Raymond was 74, a retired engineer from Tucson. He had been measuring his own blood pressure every morning for 10 years. Disciplined, methodical, frustrated. His numbers would not move below 145 no matter what he removed. His wife started slipping a handful of spinach into his morning eggs, then a side salad at lunch, then sautéed greens at dinner. He kept his daily log. Within 5 weeks, his average systolic reading dropped 11 points. He wrote it in his notebook in red pen. He said he had never trusted food to do what medication could not. He trusts it now. Here is exactly how to do this. At least 1 full cup of cooked leafy greens, or 2 cups of raw, every single day. Sauté spinach in olive oil and garlic. Add arugula to your sandwich instead of lettuce. Stir Swiss chard into a soup. Build a salad at lunch that has real volume, not 3 sad leaves under a tomato. Every day, not twice a week. Every day. That is food number 3. It rebalances the seesaw. But before moving to food number 2, take 1 second. If anything so far has felt like something you can actually do, hit the like button. It costs nothing. It tells the algorithm to show this to another senior who needs it. And it makes a small promise to yourself that this time, the change is going to stick. Food number 2 is almost never eaten by seniors, and it should be eaten every day. Berries. Blueberries, strawberries, blackberries, raspberries. Here's the mechanism. Berries are packed with compounds called flavonoids, and specifically a group called anthocyanins. The deep blue, deep purple, deep red pigment in the skin of those berries is the medicine. Anthocyanins do 2 things. They protect the inner lining of your blood vessels from damage, and they increase the body's natural production of nitric oxide. Think of your arteries as a copper pipe. Over decades, the inside of that pipe gets scaled and pitted. Anthocyanins are the gentle polish that smooths the inside of the pipe so the water flows easily again. A study published in the American Journal of Clinical Nutrition followed adults who ate roughly 1 cup of blueberries per day for 8 weeks. Their systolic blood pressure dropped by an average of around 6 points. Their arterial stiffness measured directly improved measurably, 6 points, from fruit. Margaret was 75, a retired nurse from Phoenix. She had been told her pressure was, quote, just where it is going to be at your age. She refused to accept it. Her granddaughter brought her a bag of frozen wild blueberries and told her to eat half a cup every morning on her oatmeal. Margaret thought it was silly. She did it for 10 weeks. Her pressure dropped from 144/86 to 128/76. Her doctor asked what she had changed. She said, blueberries and stubbornness. He laughed. Then he wrote it in her chart. Here is exactly how to do this. 1/2 to 1 full cup of berries per day. Fresh is wonderful. Frozen is just as good and often cheaper, and often more nutrient-dense because they are picked at peak ripeness. Add them to oatmeal. Add them to plain yogurt. Eat them by the handful as a snack instead of crackers. Every day. That is food number 2. It polishes the pipe. But the next food, food number 1, is the one that pulls all of this together. The one that, taken correctly, can move your numbers more than any single food on this list. And fewer than 5% of seniors are eating it the right way. Here is food number 1, garlic. Raw, crushed, real garlic, not the powder, not the pre-minced jar from the grocery store that has been sitting in oil for 6 months. Real garlic, crushed fresh. eaten correctly. Here is why garlic stands alone. When you crush a clove of garlic, an enzyme inside the clove activates and produces a compound called allicin. Allicin is the active ingredient. It is what does the work. But allicin is fragile. It is destroyed by heat. It is destroyed by time. It is destroyed by cooking, which is why the garlic you have been sautéing in olive oil for the last 50 years has been giving you almost none of the benefit. You have been eating garlic. You have not been eating medicine. Allicin does something remarkable inside the body. It relaxes the smooth muscle in the walls of your blood vessels. It increases nitric oxide production. And it gently thins the blood the way a low dose of aspirin does, without the same risk of bleeding. Think of allicin as a master key. Your blood vessels have tiny locks all along their walls that, when opened, allow the vessel to widen. Most foods rattle the keyhole. Allicin slides the key right in and turns it. A meta-analysis published in the Journal of Clinical Hypertension reviewed multiple controlled trials and found that consistent raw garlic or aged garlic extract consumption reduced systolic blood pressure by an average of around 8 to 10 points in adults with hypertension, 8 to 10 points from a single clove per day, comparable to a starting dose of a common blood pressure medication. Helen was 74, a retired librarian. Her pressure had been 152/94 for 3 years. She was on 2 medications and her doctor was about to add a third. Her son, who had read about allicin, brought her a small garlic press and showed her how to do it. 1 clove, crushed. Let it sit for 10 minutes on the cutting board, then eaten on a piece of bread with a little olive oil every morning. She was skeptical. She thought she would smell terrible. She thought it would burn. It did neither. 12 weeks later, her pressure read 131/81. Her doctor canceled the third medication and reduced one of the first 2. Helen called her son and could barely speak. She said, "I feel like I got 10 years back." Here is exactly how to do this, because this is where almost everyone gets it wrong. 1 fresh clove of garlic. Crush it with the flat of a knife or a garlic press, then walk away. Leave it on the cutting board for 10 full minutes. Do not skip this. Those 10 minutes are when the allicin actually forms. If you cook it before those 10 minutes, you destroy almost everything. After 10 minutes, eat it. The easiest way is on a small piece of whole grain bread, with a little olive oil and a pinch of salt. Once per day. Every day. If raw garlic is too strong, an aged garlic extract supplement of around 600 milligrams per day has been shown in trials to produce similar results. That is food number 1, the master key, the one that almost no one over 60 is using correctly, until now. Now here is the part that has to be said, even though it is uncomfortable. Why has no one told you this? Why did the last 3 doctor appointments end with a new prescription and not a printed list of 5 foods? The answer is not that doctors are bad people. The answer is that the system they work inside is broken. The average primary care visit in this country is 7 to 12 minutes. 7 to 12 minutes to review your chart, listen to your symptoms, check your numbers, answer your questions, and decide on a treatment. There is no time in 7 minutes to explain endothelial flexibility. There is no time to teach you how to crush a clove of garlic. There is only time to write a prescription, because a prescription is fast and food is slow. And the system does not pay doctors to be slow. It pays them to be efficient. So you get the pill, and the pill works. But the pill does not fix the pipe. The pill only lowers the pressure inside the pipe. The food fixes the pipe. And nobody has had the 7 extra minutes to tell you that. Here is what to do with what you have just heard. Do not try to do all 5 foods tomorrow. That is how people fail. Start with 1. Start with food number 1. Start with the garlic, because it is the most powerful and the simplest. 1 clove, crushed. 10-minute wait, once a day, for the next 14 days. Just garlic. Then in week 3, add the berries. Half a cup a day. Then in week 5, add the leafy greens. Then in week 7, add the fatty fish. Then in week 9, add the beets. By the end of 2 months, all 5 foods will be part of your daily life, and the cuff will tell you what your body already knows. Buy a home blood pressure monitor. They cost less than dinner for 2. Measure once in the morning, once in the evening. Write the numbers down on paper. Watch what happens over 30 days, then 60, then 90. The numbers will move, not because of magic, Because of physiology. Because the body that has been fighting against you for years is finally being given the tools to fight for you instead. And here is the truth that matters most. You are not broken. You were never broken. You were given half the story, half the advice, half the tools. You were told to cut and never told what to add. You were told what was hurting you and never told what could heal you. That ends today. Because you are not someone who quietly accepts that this is just how things are going to be at your age. You are someone who is still here, still listening, still willing to change. That alone says more about your future than any number on any cuff. So here's the challenge. 30 days, one food at a time. Start with garlic tonight. Come back to this video in 30 days and leave one comment. Just one. 2 numbers, the systolic you started at and the systolic you finished at. That is all. And if there is someone in your life over 60 who is on medication, who is worried, who is tired of being told the same thing in the same 7 minutes, share this with them. It might be the 7 minutes that changes the rest of their life. Take care of your body. It is the only home you have.